Hi, everyone. My name is Nikki, and I am a healthcare performance consultant and a nurse entrepreneur. And I've been doing the work of diversity, equity, and inclusion for over 5 years now. And I've learned a lot of lessons about the importance of it in any organization, but specifically to nurses, and more importantly, for nurse retention. Want to share with you about a conference that I recently attended, which was really great. It was sponsored by the American Association Colleges of Nursing. It was a diversity symposium, had some phenomenal speakers. More importantly, some really impactful leaders were present who are DEI officers across the country working on ways to integrate DEI into nurse curriculum and into nursing culture. And as I was listening and hearing what these phenomenal people were saying, deans, associate deans, faculty members were talking about, and some of their challenges in the organization, I realized that one of the critical missing factors that was really not being considered was how are we approaching leadership? Now, some of the wins they talked about, I think, are really important to highlight, especially for organizations who are really being successful at getting AI into the culture of the organization. And that is, they're focusing on systemic things like a more holistic nursing admissions process. They're focusing on creating postdoc fellowship opportunities for people of color and nurses of color. They're looking at ways to really think about weaving this into their curriculum as well. And the piece that I thought was really important that I didn't really hear much about is how do we as leaders look at our leadership style, and how does our leadership style actually impact and retain or repel nurses from the profession? So I have three questions that I think are important for any nurse leader to consider and any DEI officer to consider when they're thinking about how do we align DEI with nurse retention in our organization. And my three questions are you taking a transformational leadership approach? Are your leaders receiving coaching as a form of support and accountability? And how will your leadership approach drive nurse retention? So those are the three questions that I think that you need to ask if you're working as a leader in your organization, because transformational leadership, which is a form of coaching and providing support in organizations, is going to be a game changer so that we can engage and retain our top talent in our organizations, and that is our nurses. If you want to learn more about coach leadership, I would love to talk to you about it. I've been a coach for 15 plus years. I integrate coaching processes into all the work that I do, and I embed it into my workflow, into my strategies as I think about how to help and support all of our nurse leaders across the country. I'd love to hear more from you. Stay tuned for more.